Okay, I think we're actually going to begin. Thank you for being here. Uh, Nice to see so many people in the room, and thank you all for all the folks who are online. There's a ton of people involved in this meeting, and that's wonderful to see. My name is Mark Weiss, and I am Chair of Mid-Valley Healthcare Advocates. And our purpose tonight is to learn about universal and hopefully single payer healthcare. The voters of Oregon passed Measure 111 a few years ago. You may remember voting for this. It's in the Constitution. And so then the legislature had to do something, and they created a plan for a governing board to create a plan. Plan for a plan. And two of our three speakers are actually on that governing board that will help create whatever gets created for the state of Oregon in the next couple of years. But we are required as a state to do something. It's now in the Constitution that Oregon residents will get health care. That's a step up. You know, I sometimes say to the Mid-Valley healthcare advocate folks, we have some wins and we have some losses. We used to only have losses. But now the state has to do something. We're hoping it'll be something good, but something is going to happen. So that's part of our purpose here, to learn about healthcare and maybe now this governing board, to be fair to the two people that are on the board, they're just beginning. So they can't say, here's our plan, you know. You're going to have a chance to ask some questions, and I've got some cards. I hope you have pens and pencils. If you have a question, I'll come around. If you prefer, I can hand you the microphone. You can ask your own question. But first, we're going to hear from all three speakers, two of whom are online. Next, I want to thank heartily the organizations that are co-sponsoring with us. We have some really good local partners here. The NAACP and the League of Women Voters. We've had several. Yes, let's give them a hand. We've had a few of these town halls, and they have always been there in support of us. We also have support from Healthcare for All Oregon, a statewide group that Mid-Valley Healthcare Advocates are affiliated to. And I can't say enough about how wonderful Healthcare for All Oregon is working in this state to create universal healthcare. They have chapters all over the state. We're just one of many affiliates and chapters that they have. And they their staff works very cooperatively with us. And we have great appreciation for them. It's been a 12-year collaboration, and this year is probably the strongest year we've had between the two groups, both being 501c3 nonprofits. Do we have any elected officials here tonight? Paul Schaefer, would you stand? No. I don't think that's necessary. But wave your hand. Yeah. Paul Schaefer, City Councilor. We appreciate your being here. So I'm going to introduce Marisabel, Gouverneur. She has worked as a nurse practitioner literally all over the world, and she will be our moderator tonight. We have been arguing about who does what tonight, she and I. I'm saying I'm going to introduce you, and then that's it for me. I'm done for the night. And you do everything else. And she's saying, oh, wait a minute. So we may be a little informal back and forth, the two of us, as this evening goes along in coordinating this thing. Yes?
Did you park in the garage?
I personally did not.
I was gonna say, got you out of here if you did.
I should have said yes. I've got to go move my car. Okay, with no further ado, thank you for listening to me, Marisabel Gouverneur.
Okay, so I'm very old, and and recently had eye surgery. So I need now to wear glasses when I read. And my name is Marisabel Gouverneur. I had to explain that to my mother. Okay. Okay, and so I was told that I had 30 seconds in which to tell you why I think this is important. I'm from Latin America. We don't have seconds. So why do I think it's important? Because I have worked internationally for the United Nations, Johns Hopkins. I've been rented out to organizations. I've seen healthcare in the world, and I know how critical it can be, and I know how it impacts a society. I had family members traveling in Europe who had life-threatening crises, and they were taken care of. And when they left the hospital, we were all saying, oh God in heaven, how much is this going to cost? And it didn't cost a penny. It didn't cost a penny for a person who was not native to that country. I went to Cuba and discovered that healthcare in one of the poorest countries in the world is universal. You simply go and you get healthcare. Why did I go to Cuba? Because I had worked with Cuban doctors or Cuban trained doctors, and I was impressed with the quality of care that they had given, and also with something very special to these Cuban trained doctors, a sense of compassion I never saw in any other doctor. So my 30 seconds were already up, but I'm going to go on. And so I don't know how to tell all of you that this is not an important issue. This is a crisis. This is something that must be acted on. And to end, I'll tell you that my father used to say, take responsibility for the world that you're in. And so I'm asking you, all of you, each of you, to take this seriously, think about it. Maybe it doesn't impact you personally, but it impacts your country and the future. So thank you very, very, very much for coming and listening to my, I think it was a minute and a half. Oh, the glasses. So one of our speakers is Dr. Bruce Goldberg. He's online, and he's a member of the Oregon Universal Health Plan Governance Board. He was a past chair of the SB 770 Universal Health Plan Task Force. Dr. Santa is a past member of the Oregon Health Policy Board. He was also a past member of the SB 770 Universal Health Plan Task Force. And Marie Lou Hennrich, who's here, and she's a nurse. Nurses need to be applauded all the time for the work that they do. She's a member of the Oregon University Health Plan Governance Board and a retired CEO of CARE Oregon, retired director of Multnomah County Health Department. So that's it for me, I think, for a second here. So we'll begin with Bruce Goldberg speaking. Dr. Goldberg.
Thank you. Really appreciate it. Great to be here tonight. And first, let me thank everybody who is a part of Mid-Valley Healthcare Advocates. You've been great partners and great advocates to be certain we get healthcare for all. So thank you very much. I'm going to be really brief. I look forward to some dialogue. I was asked to talk about why I'm doing this. And, I'm a physician, and I wanted to be a physician because I understood the importance of getting healthcare. I mostly cared for populations with no or limited health insurance, and gradually I came to realize that I could make the best contributions working to make sure everybody could get the health care that they need. I chaired the Universal Healthcare Task Force, the previous work, and I've really wanted to see this through. We have an unjust healthcare system. I think, as you all know, many forego unneeded care. Many go bankrupt because they can't get care, and many go bankrupt because they do get care. The system pays less for the care of the elderly and the poor and more for the commercially insured. Our financing system is complex. We have multiple public programs. We have thousands of private programs. We have thousands of healthcare benefit plans. We don't have a consistent healthcare benefit that everybody gets. The doctors that you can see change frequently. And, to sum it all up, it's a mess. And, we have an opportunity now to put together a really great plan for the state, which really brings me to the progress that the Universal Healthcare Governing Board has made. As Mark reminded everybody, we're just getting started. We've organized ourselves into 4 committees: finance and revenue, what it costs and how we're going to pay for that. And you're going to hear more from John Santa, who's a part of that and doing really great work. We've got a plan design committee, which is really working on what's covered. An operations committee, which is looking at what's the administrative structure of this plan look like. Obviously, we hope to have a plan that provides healthcare, single payer healthcare for 4 million plus Oregonians in a just way. And that's going to need to have an administrative structure that works to assure that. And then lastly, but not least, we have a communications and a community engagement group that's working on how we can communicate this. We've had great participation. We've got some challenges. And let me end with some of the challenges before I turn it over to the next speaker. But, I think our challenges as we do this is, number one, revenue. I think that we know that putting together a plan like this, we can cover everybody. We can give everybody a better benefit that they have today. And we can do that at less of a cost than our current system has. The issue is how we get the revenue to pay for that, how we move from a premium-based system to a different system. And I think John's going to talk a little bit more about that. I think we have a communication and a political buy-in challenge. I think we have to better understand how to talk about this to people and how to gain political buy-in. Change is hard, and it's interesting. Everybody hates our current system, but there's a reluctance for people to change, and we've got to be able to speak to that. There will be winners and losers, and we've got to be able to talk about that in a way that makes sense to people. And then I think lastly, we've got to create a transition from the current system to a new single payer system in a manner that gives people confidence. It's a huge change. We're going to be asking every single person in this state to change how they get care and how their care is paid for. And we've got to provide a transition plan from where we are today to where that is, that gives people confidence about what we're doing. So, with that, let me stop. I look forward to hearing from John and Mary Lou and look forward to some dialogue and some questions.
Thanks, Bruce. I assume it's okay if I just launch away here. Well, I'm here because I'm really impressed with what you all have been doing for 40 years. As I could hear folks talking to each other in the room, I heard names that I first heard 40 years ago. And you've been persistent. There were folks like me who were skeptical. I'm no longer skeptical. A big part of that reason is Senate Bill 770. 770 is fabulous health policy written in a way that almost anybody could understand. It takes a while to read all the words, but I was convinced when I saw Senate Bill 770 that this movement was on the right track. And I volunteered for the task force, and I was involved in a variety of committees then, including revenue and governance. And I felt that the task force and its report built on 770. But, and this is going to be a recurring theme, you know, this is a house that's getting built one brick, one block at a time. And each of these efforts adds bricks and blocks and leaves bricks and blocks that need to be made and organized into a living organization. And I think we're now at a stage where we have a governance board. We have a leadership group. You know, the task force really wasn't a leadership group. It was a study group. This is a leadership group with real organizational power. And so I've been excited to serve on the Finance and Revenue Committee, but the challenges are significant. Now the committee's been meeting regularly, making progress. We've done some great work, thanks to Charlie Swanson on expenses. We've begun to define and develop revenue sources. So I would tell you that it's almost certainly going to come down to, from a tax point of view, a payroll tax and an income tax. But we can talk about more of those details. Bruce mentioned this. What you get a sense of is this is a process, and this is an idea that will lead to huge transfers of power and income. Huge. Now, actually, that's what government does. When I went to work for the state of Oregon, my first day, the president of the Senate, who was a Republican, brought me over and sat me down and said, now listen, I want to make sure you know that what our government does is take money from one group of people and give it to another. And so every time you do anything, you better be thinking of the justification for that. And it better be good, or we're not going to do it. And he's right. It's difficult, but he's right. Now, I think there's going to be a real opportunity next on the Finance and Revenue Committee's schedule to take on what I think is an incredibly important issue. The task force got it started, but I think the governing board is going to need to really move it along, and that's the issue of administrative expenses. Our current system is absolutely filled with corruption related to administrative expenses. I read recently an article that cited a study that 100,000 nurses, there's nurses out there in the audience, thank you. 100,000 nurses in the United States are working on pre-authorization. My own view is pre-authorization causes more harm than it helps. We should get rid of all of it.
Yep.
There's a huge term that you're going to have to become familiar with. This is the revenue cycle. The key priority in every American hospital is the revenue cycle. And they're spending tens, hundreds of millions of dollars on looking at every activity they're involved in, seeing how to maximize their reimbursement, turning it over to an army of coders and financial folks, and then shooting it over to insurance companies who have their own army of healthcare folks, coders, etc. There's a war going on between these two, and it creates hundreds of millions, if not billions of dollars in revenue. In administrative expense that they have to raise revenue for. In fact, the single component in healthcare that's increasing in cost is administrative costs. And we can take it on, and I hope we do. because that could be key in terms of reducing our need for public funding and making other aspects possible. And now I think there are opportunities. Bruce has been there before. Bruce has played a role in Medicaid waivers that I thought would never be granted to any state. And they came to Oregon, and they've since been granted to other states, with Oregon as the leader in terms of the idea and thinking. And I think there's some Medicaid ideas that could bring billions of additional revenue to Oregon. Are they tricky? You bet. But the ones before that Oregon succeeded with were thought to be tricky, if not impossible. In Medicare, I think we have an advantage because Medicare is having such terrible problems, especially in Medicare Advantage. I think Medicare Advantage is a corrupt effort now on the part of Medicare. The Biden administration knew that, but I think we're frankly embarrassed to bring that to the public's attention through litigation. I just heard recently that there is some litigation now around United and how they do their billing in Medicare Advantage. The opportunity, I think, is to get organized and prepared for the moments when the lights go on at the federal government, and it may not be for 4 years.
Yeah.
But when the lights go on, that just do for Oregon what you've done for Medicare Advantage. Give us everything that you would give a Medicare Advantage carrier, but to one payer. And we'll do more with it than anybody else could ever. So to be ready for that and to start making those arguments. Now, commercial is going to be tough, and that's where the issues around tax revenues are going to come in. I mean, commercial insurance and self-insured employers provide a significant portion of the revenue running the current system. So we have to figure out, do we work with them in some way? Or do we go on our own? Now, the Affordable Care Act has made it possible that the issue of individual insurance, that's coming through the feds now. It's fabulous. And so I think that stream is workable. Commercial insurers are clearly not going to be attracted to working with us. But I think many of the employers that they cover will be attracted to what we're doing because they will see that it has more value and can solve more problems than commercial insurance can. The big issue will be self-insured employers. In my sense, I've been out there talking to self-insured employers, and I think there's a growing number who have had it with the way we're doing things. But it's going to take a well-organized approach to them to sit down and sell them, frankly, on the idea that it's time to think about a different approach. You know, I think I'd close with just saying, most of us have heard the old saying, possession is 9/10 of the law. And it's never easy to take or even talk of taking resources from one revenue stream that is supporting authority to another authority, move an entire revenue stream. That's ambitious. But I think Oregon on the Medicaid side has created an unbelievably creative environment. And we need to figure out how to work with that environment, to work with the Oregon Health Plan and all the good things it's doing, and apply that to the rest of these concepts and move forward. What we'll need is to have politics that prioritizes what's best for people. And that, I know, is the challenge that HCAO and others are working on. That's the single biggest challenge, because that's not what politicians, including this state, are making their decision on now. They're still making decisions, the leadership, the majority, on what's best for business, what's best for the market, not what's best for people. We can change that. Thanks.
Should I just jump in, or are you gonna?
No, by all means, Mary Lou Hennrich will speak now.
Okay, I can, are you gonna bring me the mic, I guess? Here it comes. Careful there. Okay, there we go. My name's Mary Lou Hennrich, and I think at the beginning they told you underneath all of it, I am a nurse, a public health nurse, who has had an amazing career, doing a lot of different things and learning a lot. I think I have learned more from my clients than I ever taught them. And the people, what they're getting, and especially underprivileged and marginalized communities, is just bad. I will tell you, Bruce Goldberg worked with me at Care Oregon when we started it, a tiny little place. It's now the biggest Medicaid and OHP provider in the state, insurer. But Bruce said to me, Mary Lou, we've got to stop wallet biopsies. I went, what? Well, the fact of the matter is that when you come up to your provider and you hand over whatever little card you've got that says, this is how I'm covered, or you aren't covered, immediately it's like, oh, okay, you go through door A. Now, it isn't quite as blatant as that, but decisions are made based on what kind of card you present. And I have some hair-raising examples I don't have time for tonight, but where people really were, well, you've got that. Well, you can have the Cadillac heart pacemaker. And it's like, well, what happens to somebody who doesn't have that kind of insurance, and what do they get? So anyway, it's inequitable, unfair. And why did I get into this? Well, I just kind of, I don't know, was it the right place or the wrong place at the right time? I'm not sure. I just am one of these people who kind of, when I see an injustice, it's really hard to close my eyes and walk away from it. And so here I am. I've had people say to me, I won't disclose my exact age, but it's getting up there. And I've had people say, Mary Lou, you're retired. I retired officially from a lot of different things in 2014. And since then, I've done some traveling, done some fun things, but keep coming back to the fact that I'm going to die on a hill somewhere at some point. I just know that's who I am. And so this is the hill that I have chosen. And, be careful what you ask for, you might get it. When Warren George, who's here in the audience, and I totally respect, and he's just an amazing guy, served on the Universal Health Plan Governing Board from its inception a few months back, and for various reasons decided he needed to resign. So his position was open. And it was like several people said to me, Mary Lou, you should go for this. Well, I did. And, it may be one of those things like I said, be careful what you ask for, you might get it. So I'm not actually on it officially until March 1st. That's just coming right around the corner here, but I was confirmed by the Senate last week. And it's interesting, the people on the board, like I said, I've worked with Bruce. I have the utmost respect for what he has done with the org, just so many parts of our healthcare system and made things so much better. So Bruce and I have worked together. Helen Belanca, who chairs the board, actually worked with me at the Oregon Public Health Institute that I managed and directed for 10 years. And Amy Fellows, who is on the board, also worked with Care Oregon and the spinoff Ochin. So I know some of these people, and I know that together we can make a difference and we can come up with the plan. And as you've heard, it is not easy, but important things aren't easy. And the other thing that I wrote a few little notes down here. I'm kind of like John Santa. I wasn't really convinced that a universal health plan or single payer plan was really the answer. I was early in my career, I was kind of helping to remodel the healthcare house. You know, oh, we need this for moms. We need this, you know, for this type of problem. And so let's add a bedroom over here. Let's put, you know, a new bathroom over here. It's got to be torn down, guys, down to the foundation and rebuilt. It is, as Bruce said, it is a mess, and it's in an inequitable mess. And it is, our life expectancy is dropping in this nation, not going the correct way. I was really a public health person, and I still am, that believe in prevention is worth, you know, an ounce of prevention is worth a pound of cure. And community programs and all kinds of prevention is what I spent my life, my first 30 years doing, I guess. But my mentor, Billy Odegaard, who was the director of Multnomah County Health Department, and I owe so much to her. But Billy and I would argue about these things because there were more and more people that weren't getting health care. And so we started small clinics in Multnomah County. They now serve 50,000 low-income people who can't get care anyplace else. And I would go, Billy, we just keep, it's an insatiable thing. We just can't ever build enough or have enough. And she said, Mary Lou, until we can get everybody covered, there really isn't a hope that we can really do prevention. We've got to get everybody under the tent and get them basic health care. Then we're able to kind of step back and see what makes sense. Because one of the things when I was at the Public Health Institute, we were trying to establish a what's now the Northwest Mother's Milk Bank, but a human milk bank, breast milk for babies that needed it. And I went to the various insurers who I worked with a lot and tried to get them to come up with some money to help start this. And I got the Mary Lou, you know, I said, look, you're preventing. And I gave them all the stuff they were preventing. And they said, well, but you know, if I prevent it over here at insurance company X, but next year their employer is going to go to insurance company Y, and I'm not going to get the benefits of it. So this is kind of how they think. It's like, you know, yeah, probably should do it, but I'm not going to get the financial benefits from it. So I'm a believer that we have got to an equitable health system where people don't have biopsies. We all come in with the same card. And then we're treated the same way, or at least close to it. It won't ever be perfect, I know. But that is really important. I don't know what I've done here, but I really, that's why I'm doing it. So next question was, okay, two things. One is, I think I mentioned public health, that I'm absolutely going to be a voice for the fact that we do have to have funding for public health. And it is actually here in Benton County, many years ago, a woman named Judy Ladd was public health nurse director. And Judy used to say, public health is not the miracle of loaves and fishes. It's the miracle of crumbs and guppies. You know, just really inadequate funding. And that has, you know, inch by inch gotten a little better, but it still is not where it needs to be. And so I'm really going to be an advocate too for saying we need to look at in our financial picture, how are we going to also have funding for public health? Then the other piece that they wanted me to talk about is how you can get involved in this. We need you. Mid-Valley is it better? Okay, thank you. Mid-Valley Healthcare Associates are just wonderful partners with us with Healthcare for All Oregon, and I'm on the board of Healthcare for All Oregon. I put some of our little imagine cards, you know, imagine a simplified, equitable, affordable healthcare system with no copays, deductibles, no medical debt, no networks, and a focus on patient care over profit. everybody in, nobody out. So take one of those. And then we've also got a new little card that tells you a little bit more. It goes through actually some of this history of how we do have it in our Constitution now and what the task force did and kind of what's coming. I have my name on the back. There's QR codes that you can go to, takes you to the website. So we're getting a lot of new volunteers, and I hope that Mid-Valley is too. All of a sudden, it seems like the population has woken up to the fact that we're in a mess and that profits are driving everything, that people are getting these prior authorizations. I couldn't agree more with John Santa that it's ridiculous the amount of money we're spending. Several years ago, I did some volunteer work, public health work in Nicaragua, clean water work. And a physician who I hadn't known joined our group, and he looked fairly young. And I said, how did you get the time off? And he goes, well, I've retired. And I said, retired? And he goes, yes. He said, I had to quit. I won't name the clinic, a big clinic in Portland that he had been part of for many years. And he said, we ended up with more coders and billers and authorization people, et cetera, than we had doctors and nurses. And he goes, I just couldn't do it any longer. And I think that's happening with a lot of younger physicians, nurses, et cetera, that are leaving because it is just so stressful. And this fighting for what they believe their patient needs and not being able to get it for them. So we want to get rid of that. And it's just wasted cost. Persistence, someone mentioned, the 770 task force and its report. If you haven't seen it, if you go to our website at Healthcare for All and look up legislative, it gives the whole report and the summary, et cetera. Also information on the Universal Health Plan Governing Board. The Governing Board has a really great website with all the meetings that they've had, if you want to watch them, the committee meetings. There's a lot of information out there. Getting to know your legislator. I mean, as I see what needs to happen is in this period of the next 4 years, probably, that we need individuals who believe in this to connect with their legislator and let them know that they believe in this and keep them kind of up to date on things that are happening. But mostly it's just getting that relationship, because then the next biennium, when there's new elections and things are moving along and we really need to have their support, they know you, they trust you. You find out what they're interested in too, and you support not just our cause, but other things that will move us along. And Healthcare for All has a thing we call the drummers, which is a legislative person connected with each legislator. And so if you have any interest in kind of being that point person with a legislator, please let us know. We can always use, 2 or 3 with every legislator. I guess that's about all I was asked. And I do have a fun favorite little song that runs through my head, and it is the Gambler. And you've got to know when to hold them, when to fold them, when to walk away, and when to run. And if we could all figure out to be doing those things in the right order, and hopefully we don't have to run far, but occasionally it means we do maybe have to back down a bit, move a little, and be creative. And but with a group like this is really wonderful having you all come out tonight. And I think we're all open to questions.
Thank you, all 3 of you, very, very much. And yes, questions. Do we have a second microphone?
We may.
We may. But for now, if you would like to ask a question, I will try to bring you the microphone.
You
Dave,
don't really need a microphone, the owl will pick up everything.
okay,
We do need a microphone because it's hard of hearing all over the place here.
Anyway, I was just thinking, United Healthcare just by itself is gonna spend tens of millions of dollars to fight everything this group tries to do. What have you come up with as a way to sort of combat that? Because they're gonna have a lot of allies too.
And anyone can, any of the three of you, but Mary Lou, did you want to?
I guess my thing would be people. We won't have the money, but we've got to inoculate people to believe. Oh, I'm sorry. Okay.
We've got to inoculate people so that when they hear all of this stuff, that the insurers that are gonna be paying to convince people not to want to do this, that they're gonna go, oh, I heard that, yeah, I know why they're saying that. It's because they want more profits. And so we've got to plant the seeds in a lot of people's heads. And this is part of why HCAO is adding more chapters around the state and getting them energized and wanting people to have little house parties where they bring their neighbors and their friends in and talk about it. And we are forming it was called a speakers bureau, but they've changed the name, but it's community conversations, I think. And Mike's involved in that. And so any of those kinds of things that you need help with, or you've got an idea and want to organize around it, I'm sure Mid-Valley's willing to help, and we certainly are too.
John or Bruce, do either of you want to answer?
No, I mean, I think Mary Lou's right on. I think the issue is getting everyday people to talk about and demand a vision that's something very different. I think that's ultimately the way that we will conquer that. And that's going to take a lot of work. And I think that's about being able to communicate in language that people can understand. I think that many of us in healthcare policy tend to start to talk about things in ways that the general public doesn't understand. And I think this is about being able to clearly communicate how this is going to be different and better for people and having people start to demand that. I think that's going to be the only way.
If I could, I mean, United Healthcare has become kind of the dominant business model. It's like the drug companies, Pfizer and Merck became so dominant at what they were doing that everybody else became like them. My own sense is United Healthcare is weakest right here in your community. And you have them right there in your community. How are they doing? Are they being held accountable? What do the doctors at United Healthcare who are allowed to speak say, and what's going on there? In Eugene, the Oregon Clinic story, they're purchased by Optum. I can assure you there are incredible stories to tell there. Somebody's going to have to be courageous enough to tell them at the community level and let the community know what's going on there.
Yeah, to me, the litmus test is that everybody is saying the same thing. That when you get into an Uber, the Uber driver tells you, "This is what I want. This is what I want to see in my healthcare system." When you go to the checkout line at the grocery store, it's the same thing. That everywhere you go, everybody is talking about a healthcare system in the same way and wanting the same thing. And that's what'll win the day.
Go to another question in just a second. But there was a wonderful little article 10 or 12 years ago in the New Yorker called How Davids Beat Goliath. And probably we should all be reading it.
Yeah.
I saw a hand right back here.
I don't know how long you folks have been active, but I just learned about you
when they had the demonstration that I attended in front of the courthouse, on Martin Luther King holiday weekend there. So how long have you been doing this?
40 years.
40 years.
Well, that's concerning.
Yep.
Because a lot of us in this room, 4 years from now, when the complexion of the politics may or may not change, we may not be around. And I do see a lot of elderly, me included, in here. And, you know, there's a lot of desert rural communities out there that don't have access to healthcare at all, or they have to drive. We see that coming up a lot in the news. But change seems to be taking forever. And so many things come to mind, like more aggressive advertising. You know, there's perhaps you can get free advertisement, you know, given your mission here, with some advertising, you know, networks or whatever. But also, you know, a class action lawsuit comes to mind for me, if that might speed it up. Now, a lot of people are very unhappy with the healthcare. Here's a true story. Recently, I had scheduled a pre-authorization. So I went to my, up there on the hill, and I had to have a $400 copay before I could even move past the counter. And then I go through my scheduled 2 procedures, and I'm out of there. And I'm still getting bills for that. And what the problem I have with that is, what about full disclosure? So this is my question, is what can we do about to curb these costs, that it's a runaway train wreck here? You have no control over what you're being charged. And these are immediate issues that affect all of us right here and now. So what can we do about that?
No, I think you're exactly right. You've talked about the problem, and I think what we can do is demand from our legislators and from our policymakers that we create a single payer system where there's a single price for care. It doesn't matter whether you're Medicare, Medicaid, commercially insured, blue, yellow, green insured. It's the same price, that we have a system that doesn't charge you copays that you can't afford, and that we create that right now.
We have another.
If I can, I think that, again, you're in Corvallis. I mean, Corvallis is a special place now. I don't know if you all realize it, but back in 24, when the decisions around the Corvallis Clinic made, did you realize you had an emergency?
Yes.
Did you realize that the state declared that there was an emergency, and the emergency was so serious that they were empowered to make a secret deal with Optum to take over the Corvallis Clinic? Do your legislators know they did that? Your legislators should be leading the pack at the legislature this year, this session, to make sure that the state of Oregon doesn't do that again. The state of Oregon shouldn't be declaring emergency and then saying, we're not going to tell you why, it's all a secret. But there's a deal that's going to happen, and it's done. End of story.
Yeah, I'll just throw in Mid-Valley Healthcare Advocate had the CEO and CFO of the Corvallis Clinic at a meeting 2 months before they announced this sale. They never mentioned it. They never mentioned that the clinic was for sale.
Can I say one thing about young people? To respond to her?
We got a bunch of questions.
Okay. I just want to say that Healthcare for All Oregon has recently, especially, been getting a bunch of younger people that have been coming to the QR code saying, we want to volunteer, we want to do things. And so we are now on a variety of platforms and getting our information out, not just through groups like this, but TikTok and Blue Sky and you name it. And we've got a young man who's started to just work very, very part-time because part of all these things take money, gang. And so, you know, here I wasn't here to make a pitch for donations, but if you can, help us out because it isn't that we've had trouble finding free marketing. We're not that we're, you know, giving up, but if you've got ideas or leads on it, let us know. But we are doing, I think, a much better job of reaching a younger group of people who are very angry. And they don't have the same mindset about socialized medicine or, you know, all those things that we were kind of geared to be wary of. They're not. And so they're pushing us. And it's great because we need that younger group of people.
We'll have a question here and then we'll get the mic over there.
So just before I ask my question, I was gonna say, all these younger faces in here, just stay with it.
Yeah.
You know, you're the future.
Yeah.
You'll do it.
Yeah.
It'll change. So my question is, what is the attitude of, say, the boots on the ground, the doctors, nurses, staff at hospitals? I'll just say, you know, my doctor is great. I love him, day, etc. But, and he doesn't grouse about it, but he does say, you know, Medicare just doesn't pay like the insurance companies, whatever. So what is the attitude? What do you run into with regards to, again, to the people that are providing the services?
You know, I've seen a big change. You know, 10 years ago when we talked about universal health care, there was pretty much, you know, the majority of physicians were against it. They didn't want someone else setting their fees, etc. I've seen a huge change. Most of the physicians that we've been working with now, they want to take care of patients. They don't want the administrative overhead. They don't want to be able to, they don't want to deal with all of the prior authorizations and all of the things that keep them away from being doctors. That they want to be healers, they want to spend time with their patients. And I firmly believe that, you know, people think physicians would leave the state if we put together a plan like this. I actually think the opposite. I think there's thousands of physicians that would rather work in a place there where everybody could get the health care that they need and where physicians and nurses and other ancillary personnel were able to be healers and not administrators and dealing with all the paperwork.
If I could, my wife and I are Kaiser patients, and I think we have found Kaiser's physicians, both primary care specialists, nurses, to be pretty satisfactory, if not, you know, really strong performers. I can't recall ever running into a Kaiser physician who is as dissatisfied as many of the physicians who my friends are getting taken care of by in Legacy, Providence. You know, I follow these mergers and acquisitions. The Legacy Medical Group is in free fall. They have 22,000 people waiting to be assigned a primary care doctor. That's half the population of Corvallis. It's the entire population of Ashland. That is system failure. You know, you all may not have seen, you know, what's going on with the strike at Providence. I think nurses and doctors at Providence are not happy. And, you know, the OHSU merger, I think, is not supported, as I understand. Bruce may have a better sense of this. I don't think the faculty supports it overall. There's certainly faculty that do, and there's faculty that are opposed. And you look at some of the statistics coming out about OHSU and Legacy about their performance, it's scary. It's scary.
John, I have an audience, a friend who just had eye surgery up at KCI day before yesterday. by a very kind of famous ophthalmologist up there. And he had another person, another doctor working with him. And he told my friend that she's been going to him for a year for a very rare kind of eye disease. And he said, we're handing you over because I'm going to Kaiser. He goes, I can't take it here anymore. So, I mean, this is happening, that providers who have been loyal to various institutions and spent their lives and whatever are just saying, I can't take it. And I do know the Oregon Academy of Family Practice has officially endorsed healthcare for all. The Oregon Nurses Association has, the Oregon Federation of Nurses and Health Professionals. So more and more groups are saying it can't go on like this. And they're becoming, like we're saying, more and more favorable to this idea.
We're gonna.
Can I take a minute and address Shasta's comment in the chat that you all may not be seeing in the room, but
Yes, we'll get to the chat in a minute, but there's a question right here and then we'll go to online.
Can everyone hear me okay? Okay. Just a quick question. So I am currently a third-year public health student at Oregon State University, and I just applied for the accelerated master's program. And I was curious if there was just a list of what college students can do right now, because again, as a public health major, this is a very important topic for me, and I'm currently not insured by Oregon because I'm on state Medicaid because I'm an out-of-state student. So it's pretty much impossible for me to get healthcare here. And I'm just wondering if there's like a master list of everything we can do to get involved, because if there was, I would love to start ticking some of those boxes off for you.
it's a great question for the healthcare, Mid-Valley healthcare advocates to answer for you.
Well, I can tell you to go to HCAO's website. We've got, it's not working, I'm sorry. It's, we've got a list
for volunteers of all kinds of things. If you go and say you want to volunteer, then we have someone who will call you within a very short period of time, talk to you about your interests, et cetera. We are trying to organize on college campuses. So that's another thing that Portland State, we've got some people that are starting there. We love Oregon State. We've got a chapter getting ready to start at U of O. So anyway, please get in contact with us.
And at Mid-Valley, we've started a second group we're calling youth, a youth group 20 to 40. As many of us, yes, we have a few of these folks back in this corner. And I'll just say, I'm not sure we should be giving you a list. I think maybe you should be giving us a list. I had a young guy come and who's part of this group and filmed me for TikTok, which I can't imagine what that even is. But singing the healthcare blues. I went to see my doctor. Here's what she said. With this health insurance, you're better off dead. You're gonna pay.
Can I have the mic for a second? Listen, when I was teaching in Afghanistan, my students saw all the equipment that I had brought from the United States. And they said, how can we do what you're helping us to teach here if we don't have whiteboards? We don't have felt tips. We don't have, they just went on because I was in one of the first planes that entered Afghanistan after the bombings and all that. That was years ago. Okay, so the person who I had brought as an assistant said, oh my God, what are we gonna do? What are we gonna tell them and this and that? And I said, just calm down, child of God. And so I said, okay, I want each of you, I've given you a pencil and paper, please write down all the things that you think you need in order to teach. Anything and everything. And so they started writing, and with the hope, of course, that I was manipulating millions and I could bring it to Afghanistan. And so they wrote and wrote, and I said, are you sure that you're done? And well, a few people wrote a few more things and all this stuff. So I said, okay, now I want you to think, seriously think. Let's take a minute of silence so that we can concentrate on the response to the next thing I'm going to say. Please tell me what equipment Mohammed had when he changed the course of human history. I never got asked for another pencil. Okay, so I mean, that sounds cute and all that stuff. But what I think you need to hear, if you haven't heard it yet, is get involved. Each and every one of you have gatherings at your house, invite people, mention it. You know, I'm in the grocery store buying apples and I say, what kind of health care do you have? And darn it, if people don't respond, saying get involved with me. Do it, because we can change. We can change the course of history here. We can change it, but we have to be committed. Again, my father said, take responsibility for your world.
Okay, let's go to the online questions. We've kept them waiting a long time. Fritz, do you have any that you want to read out?
Yeah, we do. Well, actually, Bruce, you had mentioned that you saw something from Shasta in the chat. Would you like to read that question and address it? She's not able to come off micro or go on microphone.
Yeah, I think it was a really important question. Shasta said that in the flyer to the event, it was stated that the plan could save up to $1 billion for Oregon. And she wanted to know more about that and where that estimate came from. So I'll tell you, Shasta, because it's really important. What the task force did, the previous task force, is we had a national independent actuary, an expert, look at what Oregon spends on healthcare today, and then look at what we would spend on our plan, which was everybody getting a full benefit, no copays or coinsurance, etc. And when you looked at that and compared the two, and this actuary figured it all out, was able to show that a universal health plan would save about $1 billion a year over what Oregon spends today. That's everybody's health care, private insurance, Medicare, Medicaid, etc. The savings primarily came from the administrative efficiencies that we would get from such a system. And there were clearly some things that would cost more and some things less. But on the whole, in about a $50 billion system, we would save $1 billion. Even if it was the same price, this was able to give everyone a better benefit at without any copay, coinsurance. So that's where that came from.
Great. Thank you, Bruce. Tara Lynn, if you want to take yourself off of mute and ask your question.
All right, can you hear me?
Yep.
Yes, we can.
So I was wondering if we're getting bipartisan support for this, and if not, is there any plans for outreach to get support from both sides?
Mike, you
Who
want
would
to
like
answer?
to take that one?
Yes, in fact, Chuck Pinocchio, president of One Pair States, is in Washington, D.C., has been there for the last year almost, knocking on doors, primarily Republican doors. Think of Representative Bentz in District 2, east of the Cascades. They've lost a birthing center in Baker City. Their hospitals are going under. They have constituents, 30% probably getting Medicaid now, which is under threat. It's going to be hard for Representative Bentz to break away from this tendency that we have right now. But his constituents gave him an earful in the last two town halls. So We want to reach out to Republicans. They will benefit,
Reach out to both sides,
both sides.
because there's a
Yeah.
lot of Democrats that don't support.
That's right. Not all Democrats do.
And these
Yeah.
drummers I talked about, with healthcare for all,
Legislative connections, we're trying to have at least one person in every legislative district in Oregon, all 60 House members and 30 senators, and not just going to Democrats. It's harder, and we do have people who live in those districts who are developing relationships and kind of being drip, 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 hopefully some of them will wise up, but we're going to both sides.
I can give an example of that, actually. I am in Senator Hayden's district. I live out in Sweet Home. And at the 2023 session, I had a meeting with Senator Hayden, who was on the healthcare committee. And he voted that Senate Bill 1089 out of committee with a yes vote, and was backing it to basically just make sure that we had a chance to be able to talk more about it, to see if in fact it was a viable alternative for the state of Oregon. So I definitely think in the Oregon legislature, there is a certain level of bipartisan support that is there. But as Mary Lou just said, it means that we've got to be continually talking to them and sharing with them what we as their constituents want. We do have another question online. Consuelo, you had your hand up and it's no longer up. Do you still have a question you would like to ask?
Because I'm not a part of the Oregon state, I will hold off and let people who are actually impacted speak. And if there's time, I will ask my question.
Okay, that's fine. Carolyn, you had your hand up as well. I see you put something in the chat, but if you want to go ahead and take yourself off of mute and ask your question.
Thank you. No, I was just pointing out to the person who spoke that said they can't get coverage in Oregon because they have out-of-state Medicaid because they're a student, but they're an out-of-state student. I just put in the comment that there's free help and it's not impossible to actually get coverage in Oregon just because they're from out of state while they're here for college.
Okay, I believe that question was asked from in the room, and you posted a link, oregonhealthcare.gov /
oregonhealthcare.gov / get help.
Get help. Okay. And I do not see any more questions. I know Shasta had put in a couple of other questions as well in the chat. I'll go ahead and see what I could do to ask one of those for her. She's wondering how current federal Medicaid changes might affect this effort. Is this an opportunity for state level reform or a doomsday scenario?
very good question. I don't know.
Use your mic, Mary Lou.
I don't know if John or Bruce wants to answer. I think that, we just don't know. My prediction, it's not going to be good. It's going to be a big problem, but I think we need to keep in my mind, our eye focused on the prize and working on getting the very best plan and, just all the components. I am going to join the Revenue and Finance Committee with John and others. And so I think that we're in for some very difficult times, and nobody can predict exactly how bad or what it's exactly going to be. But I think we need to, this is a long game, and I think we have to keep looking at it and doing everything we can, and you never know. I mean, I keep looking for that silver lining in the cloud where they just say, oh God, that Oregon, just give them their money and let them out of here. So you never know. You never know.
I appreciate Mary Lou's optimism at the end, but I'm quite frankly very worried about what's going to happen in the short term to a number of people that will lose healthcare coverage. And I think that I'm very worried about that, and I think that it's going to behoove us to fight both the short-term and a long-term battle. And we're going to need more energy because we are going to need, to fight to be certain that as we hopefully develop a new system, which is several years out, that as we do that, we maintain the ability of people to get health care. And it appears that there's right now an effort to decrease the funding to states for Medicaid, and I think that's really going to challenge us.
If I
We do
could,
have, oh, go ahead, John, and then we do have one more online question. Go for it.
I think part of the story of single payer coverage that at least I hear from countries, other than the United States, is historically most, if not all of them, pursued these approaches after World War II. And they did so because their populations had suffered. The United States decided not to go in that direction, but rather ask, industry to respond, and the health insurance industry emerged out of that. My sense is we can already see that the suffering is starting. I mean, today's headline, oh my gosh, a child has died of measles.
Yes.
Two of them. And I look at this and I think the timing may just fit, because I think there's going to be a lot of suffering. And it's going to be important that the folks who are the cause of that suffering be held accountable. And that the country respond to that suffering by doing something that might actually work. And giving healthcare industry away to the Uniteds of the world is not going to work. So my sense is keep track of the suffering and work like hell on the alternative, and laying the groundwork for giving politicians the courage to make a decision based on what's best for people, not a market, not an industry, but people.
But in addition to that, I think what we're seeing is, a president and a Congress which are saying that healthcare is unsustainable and that we have to cut dollars from Medicaid. And they're right, healthcare is unsustainable in its current fashion. Mm-hmm. And so I think that this gets back to Shasta's question. We need to be able to show and advocate for the fact that we actually can have a system that covers everybody, that provides a better benefit, and that actually costs less and is sustainable because of that.
Great. Amanda, would you like to come off of mute and ask your question?
Sure. Good evening, everyone. Thanks for being here. I understand that it's very difficult to put an exact number, but do you have a time frame on when the governance board will be able to complete their proposal and actually bring it to voters?
Yeah, we're charged with having the plan in September of 2026, but not to voters, to the legislature. Okay. It's then up to the legislature to bring it to voters should they choose to do that.
Oh, I see.
But that's our timeline. Okay. And I'm hoping we can do that.
Excellent. Thank you so much.
I see no more hands online with questions.
There's a couple of questions back here. If somebody else.
Can I make one comment? I think it's in response. There was a comment about what are other countries doing. The task force looked at that extensively. The Universal Health Plan Governing Board has looked at it extensively. And in fact, one member of the board, who's also a member of your community, is a world expert on healthcare systems, Dr. Chun-Wei Chi. And boy, have I been impressed when he speaks. He knows what he's talking about. So I think we know a lot about what other countries are doing. It's really hard, though, for me at least, to figure out how we get our own country to listen to that. It hasn't worked so far. that doesn't convince our politicians.
Okay, I have a question. I have a couple of questions. Okay, couple of questions. One of them is, currently, I realize this could be in danger, but currently employers are mandated to offer insurance coverage to their employees federally under the Affordable Care Act. So, I'm wondering what the approach would be if Affordable Care Act stands for employers to, have basically a state single payer, but then also be mandated to offer coverage at the same time. My second question is around cost containment. So if there isn't cost containment from the payer that's based on prior authorizations and looking at expenses in that regard, what is the approach for cost containment? I asked because like Medicare and Medicaid has cost containment that's based on lower reimbursement. And with the cost of facilities, supplies, and labor increasing in the healthcare delivery service, even for nonprofit organizations, there's a risk that for the sustainability of hospitals and clinics, for example, if the reimbursement goes down from the state as payer, and another comment about that is, that Oregon is competing for labor, for expertise, for physicians and so on in a market that's national. And so if we can't pay competitive wages, we'll have an issue with access, with not being able to attract providers to operate out of Oregon and run our facilities. So I realize that was a lot, but so ACA and cost containment, basically.
Well, I'll jump in on the last one, which is cost containment. I think you're absolutely right. It's critical to create a plan that is sustainable and that costs are contained and grow sustainably. What I would say is that it makes a lot more sense and an ability to do that as a single payer plan. Right now, we have in this state probably 250 different cost containment programs. The state's got one, Medicare has several, every commercial insurer is looking for that. It's impossible for healthcare providers to keep up with them. And I think in a single payer plan, we have an ability to have a single strategy that's statewide, that has the input from consumers of healthcare as well as providers of healthcare. So I think that it makes a lot of sense to do that, because right now what we're doing around cost containment isn't working. If you look at how premiums are increasing in double-digit ways, it's not sustainable. But I believe that by having a single payer system, we can create a single way to look at and maintain what's rational cost containment. And I think this is an opportunity to do that.
Could I just clarify? I don't think the Affordable Care Act requires small employers to offer health insurance to their employees. And that's actually one of the biggest challenges for single payer are the small employers who they don't want to have anything to do with health. Since they don't cover it, it's like, no, we're not going to pay any taxes. Because if we have to pay any taxes, that's going to affect us. So small employers are a real challenge. What the Affordable Care Act did was provide coverage through the exchanges for those people, but they have to pay the premium unless they're below certain incomes, and then they get subsidized. Am I right, Bruce?
Correct. And the Affordable Care Act created a voluntary opportunity for there to be programs like the marketplace for small employers to buy into. but it's voluntary, not mandatory.
Let me start with an observation. You talked about accountability, and I think we have a president who was accountable for what, 500,000 deaths with COVID. There was no accountability. So unfortunately, I don't hold out a lot of hope that people have a memory and actually demand some accountability. Something that's not been mentioned tonight is how are drug benefits factored into this at all? Just as we have the pre-authorization game, we have the benefit managers in the pharmacy industry who are doing horrible things and driving independent pharmacies out of business. And I'm just curious, is that part of this process, or will that be a separate challenge to be faced at some point down the line?
It was.
No. Go ahead, Mary Lou.
I was just gonna say that when Bruce talked about the $50 billion a year that we're spending through all these different sources, and if we had a single payer plan covered everybody, that it would be 800 million, almost $1 billion less, okay? But drugs were and pharmaceuticals were included in there. They were part of that study, okay? And I think we get rid of these PBMs and a lot of this other kind of craziness by having a single system. Is that accurate, Bruce? John?
Yeah, in fact, I would say that that figure of having drugs in there, quite frankly, didn't take into account getting the dollars out of the PBMs. So that would be some additional savings. It was actually looking at just pricing of drugs, not at the PBM piece. So I think that the savings are even greater.
I'm Charlotte Kinney Joseph. I am a member of the Oregon Pain Science Alliance, which is a group of lay people who are working to help educate people on how pain works. And I just want to ask you, in your plan for coverage, are you going to cover pain education? Some of the work that's being done, like by Dr. Clark up at OHSU, what Dr. Sharna Prasad has done over at Lebanon Samaritan with the MAPS program, non-medical, non-invasive pain therapies that really work for chronic pain. I really hope that you make sure and take a look at them when you're making your plan. Thank you.
Good feedback. Thank you. We're not yet at the level where we're looking at line by line what's covered and what isn't, but that certainly sounds like something that would make a whole lot of sense. And apropos of what Mary Lou was talking about earlier in terms of public health and prevention, I think we want to start to create a system that is preventive and less invasive and speaks to some of the things that you've been talking about. So thanks for that comment.
And if you want the Universal Health Plan Governance Board, I have a hard time getting that out sometimes. Their meetings are online and they do accept public comment. Yes. And they do encourage public comment. And so I would encourage you, especially to start following the plan design.
That would be the plan design committee.
The plan design committee, see when their meetings are and keep hammering that.
Can I say one thing about the question back here that came up about your doctor complaining a bit about that doesn't get as much reimbursement from Medicare and as he does from commercial, and that's very true. And it kind of is stepwise with Medicaid, Medicare, and commercial. And so that's one of the issues, is figuring out provider reimbursement that for simple terms averages that or does something so that it is not those commercial plans too. The finance projections that were done by the actuary, did take into account all that money that's being spent at those various different levels. And so how provider reimbursement exactly will go, there's going to be a lot of discussion with providers about that. And some right now, some of the specialists get quite a bit of money, while primary care people get a very smaller amount of money. And, this is it's gonna be difficult. But we know that we need more primary care and that they have been short-sheeted here with reimbursement. And so all of this, it's complex, but those are the things that this governing board is gonna have to deal with and talk with provider groups and get input. And I think it was Bruce who said, there will be winners and there will be losers. There will be some that are not gonna be happy, but the majority, and based on what we need to keep our society healthy, we need much more at the front end.
But actually, when it comes to physician reimbursement, in that plan that saved $1 billion, in reality, physicians in the aggregate were going to get paid more.
Yes.
Because what we did was we took what physicians are currently paid in hospitals, and put together all the reimbursement, and then averaged that so that if it was $100 for commercial and $50 for Medicare, the reimbursement would be $75. It averaged all of that. But what it didn't take into account and take out of that was all the administrative savings, which is estimated to be 10 to 20%. So in a certain way, in the aggregate, physicians were going to get paid more. That was actually a contentious issue for us because people felt we should reduce that even more. And I know John was very involved in that and's got some comments.
Yeah, well, I think that idea is called normalization of a payment by the actuary, is the biggest idea that the task force had, and I hope the Universal Health Plan Governing Board. It does result in a huge transfer of revenue in your community, and you can go back to the documents filed by Optum and Corvallis Clinic. One of the advantages that the Corvallis Clinic had, and one of the reasons why they were attractive to Optum, is they are more successful at attracting commercial patients. And they were willing to take care of Medicare Advantage patients as United. That was very desirable. Samaritan Health is less successful at attracting commercial health patients. Imagine if that disappeared and every patient was, if you will, paid for at the same amount. There'd be a huge shift of revenue away from the Corvallis Clinic to Samaritan Health.
Okay, thank you. I think we need to draw this meeting to a close. It's been very fruitful. Let's thank our presenters. And thank you. I know all three of you spent a lifetime working on trying to create a good and reasonable system, fair and equitable system for our state and our country. Once again, I want to thank our co-sponsors, the NAACP, the League of Women Voters, and Healthcare for All Oregon, for helping to create this event. And thank you all for coming.
Are you a 501 for donations? I think that's an important question to address here.
We are a 501c3, so you can donate successfully to Mid-Valley Healthcare Advocates. The same is true for Healthcare for All Oregon. And the same actually for NAACP and